Kegels are a pelvic floor muscle contraction, and they do help to strengthen the pelvic floor when that is needed. But there are other ways to strengthen the pelvic floor, such as working on single leg strength, lower extremity or lower leg strength, core strength. So it's not the only way to help strengthen the pelvic floor, and it may not be necessary right off the bat for your pelvic floor session. You do not have to do an internal pelvic floor exam during your pelvic floor physical therapy session. However, I do strongly encourage it because it allows us to get the best information regarding with what dysfunction or issues that you're dealing with your pelvic floor. Any form of urinary leakage is not normal, whether it be just a few drops to having to wear a liner. That is considered a pelvic floor dysfunction, and there can be many causes for that. Yes, you can have leakage without having a baby. Some of the activities that we perform, like if you're a power lifter, Olympic lifter, CrossFitter, or do a lot of high intensity exercises, can create a lot of tension within the pelvic floor. Or on the other hand, if you're more sedentary or don't do a lot of activities, we can have some weakness within the pelvic floor that can allow for leakage. Yes, physical therapy can help with prolapse. It can help to strengthen the muscles surrounding the tissue and kind of help to uplift that tissue a little bit, as well as help to create some behavioral changes to help address some of those symptoms. So diastasis recti abdominis is the separation of the linea alba. So the linea alba is a connective tissue that runs down the center of your abdominal wall. And most commonly, this is seen in our pregnant population. However, it can be seen in men and babies. And so what happens is that the abdominal wall expands as the baby grows, or we just have some genetic abnormalities that cause that separation, which is natural. But we can use strengthening activities to help strengthen the surrounding muscles that can sometimes help to kind of close the tissue or bring it closer, but more importantly, help to create stiffness around that abdominal wall. Yes, pelvic floor physical therapy is recommended for pregnancy and postpartum. It can be used to help prep for labor and birth. It can help to strengthen as well as work on relaxing the pelvic floor muscles to prepare for that. It can help to address some of the many changes that your body goes through during pregnancy and postpartum. And then it can help you create kind of a birth plan going forward, as well as recover from that birth.